Hi friends, how are you doing? Today, in this video, we will talk about the only effective way to combat coronavirus, a solution to save the life of millions. More importantly, we focus on how and it works because the only way to make sure someone follows and stick to a solution is having a proper understanding and conviction. The solution is something everyone can practice right away. The one and only solution is social distancing.
Social distancing has already become a popular term, and many of you might have a good idea about what it is. But unfortunately, what we see around is that it is not practiced well, as if it's not taken seriously. We see people walking around, coming in contact with people and objects in the public places. Looking into the matter more deeply, what we understand is even though everyone is aware of this concept, there is a lack of conviction among the people about its effectiveness. So we dedicate this video to convince you all that social distancing really works. But without observing it religiously, even a single person can become a hole in the net, collapsing a whole society. We will explain this with a real-world example.
Have you heard about the story of patient 31 from South Korea? A 61-year-old got admitted to a hospital following a minor car accident on February 7th. She left the hospital to attend a church service on February 9th. Later, she developed a fever and hospital asked her to get screened for COVID-19, which she refused. She conducted her life as usual. She met a friend over a lunch buffet. On February 16th, she attended yet another church service. Finally, the next day, she agreed to get tested for COVID-19 and was unfortunately detected positive. But more unfortunate was, by this time, she was already a super spreader. Some reports say this patient 31 was the root for approximately 60% of all coronavirus cases in South Korea. All this could have been avoided if she had agreed for the test at the right time and kept a social distance. This is a story we all have to keep in mind.
As of today, more than 31,000 people have died because of COVID-19 coronavirus. With proper practice of social distancing, we could have restricted the count to just a fraction. First, understand why these many people died. The only reason is that they did not get proper medical treatment. With enough medical attention, fatalities could have been mitigated. But the spread of this pandemic is exponential and it goes out of control. That's what we see around the globe. Countries like China, Italy, Spain, Iran, USA have reached a point where they are helpless and has no other option than to watch people die and push them to death, hoping to save someone who is more probable to survive.
Let's get to the basics. Any hospital in your city has a maximum capacity. It has only a limited number of beds. A part of it is already occupied by existing patients from accidents, stroke, etc. This is how our health system normally works. Now comes our villain. In some part of the world, a new strain of coronavirus was born. It lived in animals for some time and, in its quest for a better abode, jumped into a more interesting animal, human. Slowly, it jumped from one human to another. If you are a healthy person and come in contact with a person carrying coronavirus, you will not come to know that you have been affected, as you do not show any symptoms for a week or two. Some do not show any symptom at all. But what happens during this time is they come in contact with many at home, work, social gatherings, sports, events, etc. With each contact, they transmit the virus to a few others, and these others transfer the virus to a few more.
The virus keeps spreading. Out of these, less immune people, especially elderly, might show severe symptoms and get diagnosed, get hospitalized, and get isolated. But the rest of the healthy, affected people will still go around the city with their daily life as usual and keep spreading the virus. So, in the next 7 days, 20% of the affected people need hospitalization. And in a few days, the hospital gets filled up and cannot accommodate any new patients. We lose valuable lives for lack of medical attention. It affects not just coronavirus patients, but patients with other chronic illnesses and accidents during this time also suffer. This is exactly what happened in China, Italy, Iran, Spain, and USA. In a week, cases jumped from 100 to 10,000. The spread is exponential, and this is what we have to block. We have to break the chain.
So, the healthy, you and me are the ones who can save the rest. How? If we did not enter that bus, if we stayed back home for work, if we had avoided that party gathering, that sports event, that day's gym. You are not just saving yourself and your family, but the rest of your society, rest of the city, rest of the world. This virus is so contagious that at some point majority of us will be affected by it, but it's not fatal if given proper medical supervision. What we do by social distancing is flatten the curve, flattening the number of patients at any single time. As a result, the number of COVID-19 patients would be within a manageable limit. This makes enough medical resources available for the needy.
These coming few weeks are critical. Practice social distancing without fail to save the life of thousands. You need not wait for a complete lockdown by the government authorities. You can practice social distancing right away. It is the only truth in front of us to save humanity from sufferings. Why we stress a lot on it is because it is the only proven method against coronavirus. We have already seen that in any country that declared a lockdown, from that point onwards, the cases of coronavirus has come down. So, do we need to wait for the government to declare a shutdown? No, a complete shutdown is the last step. It has got economic and social repercussions on that country, which ultimately affects its residents. Bottom line is we should start following social distancing strictly right away.
Social distancing is the most effective and easy step because we do not have to get into isolation and quarantine for this. We just need to change a bit of our lifestyle. Governments have already dismissed schools. Many schools have switched to online classrooms. If you are an employee, ask your employer for work from home option. If you are an employer, protect your employees' health by facilitating them with work from home option. Cancel all social gatherings and events at this point. No event is as important as your life. In today's highly connected world, there are easy alternatives for face-to-face meetings. Stick to online and virtual communications as much as possible. You do not need to completely isolate yourselves. Keep in touch with your friends and families online. Shop online, work out at home, spend quality time with your family. Take it as an opportunity to stay home. Never go out in public when sick. Avoid clinics and hospitals unless necessary. Practice personal hygiene more. In case you need to go out for an emergency, keep a distance of at least 6 feet with others on streets and while shopping. Do not touch objects unnecessarily. Avoid handshakes. For work, opt for work from home if possible. Avoid face-to-face meetings and instead adopt online communications. Keep your workspace clean. In short, social distancing is a change in lifestyle to prevent or reduce the spread of virus. It is a conscious effort to reduce contact between people to slow down the spread of virus.
Let's pledge to do this together and save our fellow beings. Comment below if you have more inputs. If you find this video useful, don't forget to like and share with your friends and family. Stay tuned to our channel by clicking the subscribe button with the bell icon.
Go Corona, go!
Go, 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 go.